The ACIST HDI system is intended to be used for the intravascular ultrasound imaging assessment of coronary and peripheral artery disease. The ACIST Kodama intravascular ultrasound catheter is intended for ultrasound examination of coronary and peripheral intravascular pathology. Intravascular ultrasound imaging is indicated in patients who are candidates for transluminal coronary interventional procedures. The main components of the HDI system are as follows: the console, patient interface module or PIM, linear translation system or LTS, and the power supply. The system allows you to zoom on the longitudinal part of the image. Press the upward or downward double chevron button to maximize or minimize the longitudinal view. Preference is largely based on the distance the user is from the console. The longitudinal image can be rotated about the cut plane axis by swiping downward or upward along the longitudinal image, or rotated by dragging the cut plane rotation handle in the cross-sectional image along the outside edge of the cross-sectional display. The Kodama catheter is a minimally invasive intravascular ultrasound imaging catheter for the examination of human coronary and peripheral pathology. The sheath assembly has a hydrophilic coating that enhances catheter lubricity when introduced into the guiding catheter and coronary anatomy. The Kodama catheter is compatible with 6 French and larger guide catheters. The monorail has a distal radiopaque marker that is located approximately 8 millimeters from the distal end of the catheter. The catheter's distal tip entry profile is less than or equal to 2 French. The crossing profile is less than or equal to 3.2 French, and the working length is approximately 142 centimeters. The catheter has a greater than or equal to 12 centimeter long imaging window and associated telescope assembly. The catheter's femoral marker is located approximately 100 centimeters from the distal tip of the catheter. The transducer is attached to the distal end of the drive cable located within the body of the catheter. The drive cable is mechanically rotated by the HDI console and continually rotates through 360 degrees. Additionally, the imaging element can be longitudinally translated along the 12 centimeter imaging window by extending and collapsing the telescope assembly. This mechanism allows for examining the vascular tissue along the length of the artery without moving the catheter. The longitudinal translation can be performed manually by the physician or under motorized control from the LTS. Motorized longitudinal translation enables the acquisition of calibrated 3-dimensional volume data that allows the HDI system to accurately measure distances along the length of the artery under investigation. The Kodama catheter is to be used in conjunction with standard protocols for coronary cannulation. It is designed for use with a 14 thousandths inch diameter guide wire approved for intercoronary use and approved 6 French to 8 French coronary guide catheter with a minimal internal diameter of 64 thousandths of an inch. Guide wires that provide more distal support reduce the risk of guide wire prolapse and entrapment and are recommended. As with any interventional procedure, proper anticoagulation and antiplatelet therapy should be used per current guidelines. The console interface has 4 interface areas available for operating the system: Acquire, Analyze, Archive, and Assist HDI information. Upon power-up, the system opens to the Acquire interface screen, where imaging and recording occur. Press Analyze to open the Study Review and Playback interface. Press Archive to open the section where you can enter patient information, and open, close, delete, and export studies. Press ACIST HDI to open the information screen. This view contains two tabs, Info and Settings. This is also where the shutdown button is located. To start recording while using the PIM and LTS with the manual pullback, press the manual button on the LTS. Confirm the button is illuminated, indicating the LTS is in manual mode. Press record on the console touchscreen or on the PIM and slowly draw back the PIM along the track on the LTS to pull back the imaging element. Press record on the touchscreen or press the record button on the PIM again to stop the recording. To start recording while using only the PIM and manual pullback, press the record on the touchscreen or on the PIM. A green light illuminates on the record button of the touchscreen when recording is activated. Firmly grasp the telescope anchor. Slowly draw back the PIM to pull back the imaging element. Press record on the touchscreen or the PIM to stop recording. The setup procedure involves connecting the PIM and optional LTS to the system console. To connect the PIM to the console, align the red dot on the PIM connector to the red dot on the PIM receptacle on the underside of the console. Carefully insert the PIM connector until it is securely seated. To connect the LTS to the system console, align the orientation key on the LTS connector with the slot on the LTS receptacle on the underside of the console. Carefully insert the connector until it is securely seated into the receptacle. As a reminder, never connect or disconnect live cables since electrical damage to the equipment can result. The optional LTS is connected, verifying the LTS indicator is shown in white on the touchscreen. ACIST Connect retrieves modality work list data and makes it available on the HDI console. ACIST Connect also transfers closed studies from the HDI console to the Picture Archiving and Communication System, also referred to as PACS.